This is Stombolus. This is another video for Ethicare Dental, and we had a request from someone who saw our video on Facebook that to make a video to let our viewers know, let our patients know what's involved when seeing children at the practice. And so we're going to be talking a little bit about that, and I always kind of asked by patients, when is the first age, when should we bring our child to the practice? Well, I say to patients that perhaps at about a year old would be a good idea to bring your child to the practice. Actually, it is quite difficult sometimes. Often expectations are very important. How much are we going to be seeing as a dentist of your child's mouth at a year old? Well, maybe not very much, but it's definitely worthwhile bringing them from a year on. We might be able to see if there's anything major going on. We might be able to count what teeth that they have. If there's anything major going on, it may be that there's not much that we'd be able to do, but we'd be able to at least refer them on to either specialist centres or centres who are better able to manage children of that age. So it's worthwhile bring them along, even if you think that it may be that your child is going to be difficult to manage. It's not something that there would be no pressure. There is no charge for checkups, by the way, if adults or their parents are registered here at the practice. And in fact, from 5 years and below, as long as their parents, one of the parents, are coming on a yearly basis and registered with the practice, there'd be no charge for the actual checkup appointment of your child. So from a year on would be a good idea, so that we can make assessments. Then at that point, every 6 months generally would be a good idea to bring your child to the practice. That differs for adults in terms of the timing. Again, we've discussed that in another video. But for children, decay, the teeth are smaller, and if decay does occur, that can occur at quite a fast rate, and obviously things are changing very fast in terms of the development of the teeth and coming through and so on. And so I would say it's important to bring your child every 6 months. And as your child matures, there's going to be various things that we're then able to do. So, I mean, at a year, you're not going to be able to do very much, but you can have a quick look just to make sure there's nothing major going on. You can check which teeth are coming through. As time goes by, you're going to be able to see more. Your child will have more of a memory of what is happening at each appointment. You'll be able to introduce various story times. There are Peppa Pig storybooks with dentists to introduce that to them, so they'll have more of an understanding of what is going on. We'll be able to talk to them a little bit more about toothbrushing, about the causes of decay and so on, so they'll be able to have a better understanding there. And also just to get them used to the environment, to make them see that it's not a scary place, and that there's a person there who's kind of looking after their teeth. And then as time goes by, again, there'll be more instruction that they're able to absorb. So one of the things that we do, I use what are called disclosing tablets, which shows them, which they chew, and it stains dyes their teeth, so that you can see where the bacteria and plaque is, and then we're able to brush it away, and then give them instruction about keep the bacterial levels low, talk to them about the difficulties with sugar and things like that. And then usually at the age of about 5 or 6, we look at, for instance, taking x-rays, which can be difficult to take on some children, and may perhaps impossible. And if it does prove difficult, then it's something that can be left often until another time. Obviously, if it's something that we think is urgent and we can't do it, then again at that point we'll deal with it. We'll look at potentially either referral or to a specialist clinic or something like that. but generally speaking, it's something that can be deferred until the child becomes a little bit more mature, and then you're able to take x-rays. And then as a child gets older, perhaps again at the age of 5 or 6, having a short hygiene appointment is often of value, so that you can have dedicated time to show children how to brush their teeth, how to floss their teeth, how to clean between their teeth, and the importance of sugar and dietary factors and so on. But it's not all about the information you're able to pass along to the children. It's also giving reassurance to parents, what and what not to do during the early years, what type of toothpaste to use, what size brush, how much toothpaste to put on, what they should be doing to keep the teeth clean at an early age. Those kind of things are the things that we'd be talking to parents about, and then eventually to children as they mature, and giving proper tailored advice as the child matures. So definitely worthwhile bringing your child to Ethicare Dental from about the age of 1 onwards. Thank you.